So I know a lot of you may have been expecting at one point to hear Laura Kahn speak this evening. Unfortunately, she is fighting the flu and currently doesn't have a voice, which will make it hard to do a talk today. So Dan Lucey, who facilitated getting Laura here, actually decided to step in very graciously. He's a physician working at Georgetown University. He's done numerous outbreaks with various different diseases, and most recently he's been working with Zika. So I want to pass it on to him. And in the meantime, I want to mention for One Health Academy, we usually have everybody stand up and introduce themselves. Since we have a full house today, I think we'll forego that tradition. But I want to encourage questions after this. I know Dan's not planning on talking the whole hour. And we can also then have plenty of time to talk afterwards and get to know everybody. There's plenty of interesting folks here. It's not on? Right next to me. We're just going to have to record a
live webinar?
Yeah, so we're live on the webinar too. But that's why I wanted to use the microphone to try and get a little bit more volume so we can make sure it's recorded here. All right. So without further ado, Dan Lucey.
Thank you very much, Will, and thank you for everyone who's came here tonight, despite the fact that I'm the substitute matter and Dr. Khan's not here. But we'll talk with her, and she's looking forward to coming back probably in the fall to speak when her voice is back. So it's really a pleasure to be here. I have only 19 slides, 5 of which are pictures, and I'll try and keep it short because I think that there should be questions. I don't know otherwise why did people come. Questions for discussion. So you can see I used to teach grade school, so I like to show and tell. So there's various posters, the slides, the newspapers that I picked up in Brazil, February 9th to the 16th about the Zika and microcephaly and Aedes mosquitoes and all. And Will asked me to emphasize about the zoonotic aspects and the environmental aspects of Zika, which I have to admit, a little bit outside my expertise, the medical paradigm, but I'm trying, so bear with me. And the first few slides will try and focus on that. And I see Tim Stevens isn't here. He was talking to me last month here at the meeting about the Anthropocene, the age of humans. And so I put that into the subtitle of of my talk because really, Aedes are really bad actors as far as our species is concerned, in my opinion. And it's not just Zika, which is now everywhere. It's chikungunya. There's been 2 million cases in the Americas since December of 2013 when it first appeared. When it was first recognized, I should say, in December of 2013, same month. 2 million cases. Certainly dengue everywhere, and dengue more cases last year in Brazil than in the previous 10 years. And now, as you all know, just in the past few weeks, it's yellow fever coming out of Angola, across Angola into DRC, into Uganda, perhaps into Mauritania. Perhaps 10 people have flown home to China with yellow fever from Angola. So Aedes strikes back. Take off on Star Wars. So the first slide is also my effort to emphasize the One Health paradigm. And as some of you know, including Dr. David Moynes, who's here from the NIH, who works with Dr. Fauci, and we actually met about a week or so ago to talk about this One Health exhibit. It's going to happen at the National Museum of Natural History on the Mall. It takes a long time. We're still raising money, but we've raised enough money so that now it's guaranteed to happen, at least on the mall, at the National Museum. It isn't guaranteed to be able to travel nationally or internationally yet, but if we raise more money, then we'll be able to do both things. Right now it's called Outbreak. It has 8 sections. There are basically 8 viruses, all of which are zoonotic. And section number 1 is called One Health. So there's 8 sections as you walk in this direction from left to right. So section 1 is One World, One Health. Then we go from spillover to outbreak. And I won't tell you which viruses we have there. These change. And then number 3 is section 3 from outbreak to epidemic to pandemic. Or my new favorite word that I just made up is pan-epidemic. So there's all this debate about what is a pandemic or what is a pandemic, so even in 2009, pandemic flu, really everybody, that's a pandemic, right? But some people said, no, it's not a pandemic. So I'm taking to using the word pan-epidemic. So it's epidemics in a lot of places, may or may not meet the definition of pandemic, or somebody's definition of pandemic. We go on to section 4 from response to research. Right now we're thinking that would be Ebola. and it still will be, but it may well be Zika by the time the exhibit opens, which isn't until March of 2018, which is the 100-year commemoration of the 1918 pandemic of flu. So in the central section of 5, we'll have pandemic flu and avian flu. Pandemic flu from 1918, basically up until today, but also MERS. And also, of course, the one pandemic of our generation that no one could question, right? Because it's everywhere and it's uniformly fatal, hopefully not eventually, but HIV. And of course, Zika now will be here. As of the end of January, we obviously added Zika. And then there's a section of survival and resiliency. So we hope to have people from around the world that have survived various diseases, whether it's HIV or it's Ebola, or whatever it is in this section. And then in the end, everything's connected. So again, come back to the One Health theme, and then end with section 8, what's next? So One Health is an explicit part of that. So thanks. So now to move on to Zika. So for whatever reason, I'm into making new words and phrases, acronyms. Medical school, they told us that can be a sign of psychiatric disease. So I'll let you judge. But it seems to me that we should call Zika Neurological Syndromes, or ZNS, like Central Nervous System, Zika Neurological Syndrome. Because basically it's a virus that's tropic. It goes to the nervous system, it invades cells, and it has clinical manifestations that affect the nerves, both in children or the fetus, so the so-called Zika congenital syndrome. That I didn't make up. That's just a very interesting case in the literature. And I call more Zika neurologic syndromes that occur in children or in adults, but not in the fetus. And the congenital syndrome, there's a long list. You probably saw this yesterday in the British Medical Journal, a group from Northeast Brazil, Brazil, Pernambuco State. Some folks I was able to visit with, largely thanks to David and Lawrence, February 9th to the 16th, published a paper talking about findings in 23, findings on brain scans in 23 babies who has microcephaly. We'll just step down. Okay. So that's why I call it Zika neurological syndromes, to emphasize that that's the clinical manifestation, the medical manifestations, whether it's to the fetus or to an adult or to a child. And it might be.
All right, we're gonna have to grab Will when he gets back in here. I'm sorry.
Okay, so it's gonna be a really short time. No slow. And there's a growing list of neurological diseases or syndromes that even just in the past week it's continued to grow, that are being attributed, at least associated with the virus, not necessarily proven, but the one that's most common so far, I'd say Guillain-Barré syndrome, asynchronous paralysis can start at the feet and work its way up and affect your breathing muscles, your diaphragm muscles, and you have to be on a breathing machine or you die. There's the World Health Organization in their weekly update, April 7th, said that Zika is a cause of both microcephaly and Guillain-Barré syndrome. Today, as you know from all newspapers, most of the time, all newspapers are saying the CDC announced yesterday that, in their view, yes, Zika is a cause of microcephaly, but our US CDC has not yet weighed in on whether was found first in Uganda, in Entebbe, right near, there's a short distance from the airport of Entebbe to Kampala, the capital. The Zika Forest Research Center was there, and it was isolated from a monkey that was being studied as an experimental, it was actually an Asian monkey, rhesus monkey that was being studied to try to work out the sylvatic cycle of yellow fever virus. It was funded by Rockefeller Foundation. And I think that this raises an important question, whether there is a sylvatic cycle of Zika virus. And whether anybody's looking for that in Brazil or in South America or Latin America. And I called our friend today, you all know John Epstein of the Equal Health Alliance, and he said that the USAID PREDICT program is starting to look like it hasn't done it yet. So maybe some of you know about research that's going on in that regard. There was an apparent series of deaths of howler monkeys in Nicaragua recently, in February, I think. Someone raised the question, is that due to Zika? I haven't seen a definitive answer, but I suspect if the answer was yes, we would have heard of that. Also, as far as monkeys as an experimental model for Zika, they can be infected, and they are being infected. For example, at this group at the University of Wisconsin that was described by Declan Butler in Nature, 23rd of February. They infected the monkeys, and the data that they generate, they post online, or at least this is what the paper said. I didn't verify it myself, but they posted data every day. I mean, that's I think unprecedented in terms of scientific collaboration and putting your data out there. Okay, I need to. Probably means I need to speak faster, move the slides faster. So, as promised, environmental connections to Zika and Zika neurologic. Since I'm making the slides, I guess I can use the abbreviation, even if nobody else ever does. So I'd say that's the Aedes mosquitoes, possibly other species. And the best I can tell, again, please, David or anyone else who knows more than me, Aedes albopictus, to the best of my knowledge, they can transmit the virus, or at least experimentally they can be infected, but perhaps, hopefully, they don't transmit it as well as Aedes aegypti. And the home lesson for us, obviously, is that albopictus has a much greater range in the United States than does Aedes aegypti. So it's a mosquito that is peridomestic, that doesn't travel very far, approximately 100 meters is what I've read, lives near where humans live because it wants our blood. And can lay eggs and thrive in very small amounts of water, tiny amounts of water. So how can we control that? How can we stop that? It's extraordinarily hard. In addition, these are pictures from newspapers that are coming around from early February in Brazil and Recife in the Northeast. But this is just a picture from Recife. You can see there's water everywhere. Old water bottles, rainwater, all sorts of water. This is just a typical street scene. Recife is also on the ocean. There's water, all sorts of water everywhere. How can you remove all of the sources of water that Aedes mosquitoes could use to breed and then to fly within 100 meters and infect people with Zika? Very, very difficult. Under the best of circumstances. And whether it's Northeast Brazil or it's Puerto Rico or it's the Gulf Coast, Gulf of Mexico coast of the United States from Florida, Louisiana, Mississippi to Texas. And there are some folks, someone who used to work here, you probably know at GW, Dr. Hotez, who's dean of the School of Tropical Medicine in Texas. And he's written a lot of very interesting articles, I think, including one in the past week called Zika is Coming. And the subtitle was something to the effect of, if I was a woman who was pregnant in Houston now, I'd be very worried for it in the coming months. And he argues that the Gulf Coast of the United States, socioeconomically, and in terms of people not having access to air conditioning, not having screens on their windows, they're susceptible to Aedes mosquitoes, much like Northeast Brazil or Puerto Rico or so many other Venezuela or Colombia. And staying on the theme of environmental issues and mosquitoes, I'm jumping ahead here a little bit to last month, where the World Health Organization convened a meeting of what's called the Vector Control Advisory Group, or CAGB. And they discussed vector control, particularly Aedes, as an intervention against Zika. And these are their main conclusions or recommendations with regard to what can be done right now, what they recommend be done right now in terms of, I think they use the word traditional vector control measures, such as targeted residual spraying, larval control, personal protective measures, And then there are what I would call more investigational methods to try to control the Aedes mosquitoes, like infection with bacterial Wolbachia, which in some manner that I don't understand. Again, please, if anyone else does, speak up. Mosquitoes infected with Wolbachia are less likely to be infectable with the viruses, not just Zika, but viruses. Then there are transgenic mosquitoes. There are sterile mosquitoes. Something called attractive toxic sugar baits. Liking about that, like St. Petro movie. I'm not that attracted to it, but I think maybe these might be, and that's what matters. And then innovative vector traps. So the point is, I think that I'd like to make is that what can we do right now to try to stop these mosquitoes that are transmitting the virus to our species, including women who are pregnant? And we're not going to have a vaccine for a very long time, in my opinion. Tell me what I said, but a very long time, years. We're going to. I believe that NIH is going to start phase 1 clinical trials perhaps in September this year. By coincidence, it was September 2014 when the Ebola phase 1 clinical trials were started. I remember, but it's phase 1 means small numbers of people, 20 perhaps. It's a long road to getting licensure of a vaccine to show it's effective. We still don't have one for Ebola, for example. There's no antiviral for Zika. So what we have is to do our best to strike back against the Aedes mosquitoes that are striking back against us. And it seems to me, as a non-entomologist, that whatever interventions we can improve on against these mosquitoes compared to what we have now to fight Zika should translate into fighting the same Aedes mosquitoes that transmit the other 3 big major viruses, the yellow fever virus and chikungunya and dengue. So it could be of value to the outbreak of yellow fever in Angola spreading up to DRC, for example. The chikungunya epidemic that's infected 2 million people by most estimates by PAHO, for example, in the Americas in the last 2.5, almost 3 years. So now to the more traditional medical and what I do and like to do. But I'll go pretty quickly, okay, I'll try. So I always like timelines, so it's history, timelines. So it's a brief timeline though. So there's just 2 slides. So this is my understanding that Zika actually came to Brazil in December of 2014. It wasn't recognized, laboratory confirmed, until May of 2015. So that time period is even longer than the story of Ebola, which came beginning, we think, in December of 2013, wasn't recognized until March 22nd, laboratory confirmed, that is, of 2014. A distinguishing clinical medical aspect of Zika is that it has an itchy rash. So dengue has a rash, chikungunya have a rash. They both can have joint pains, as Zika does. But as best I can understand from practicing doctors in Brazil and reading the literature, is that the rash is itchy. In fact, the senior person at the Pan-American Health Organization, PAHO, here in DC, Dr. Marco Espinal, gave a talk here in February that I heard, and he said initially some medical people in Brazil, and they were seeing, there were thousands of patients in December, January, February, early 2015 and 2014. That made this kind of allergic reaction because that can cause itchiness, pruritic or itchy rash. But no, it turned out to be Zika virus. Then by July 2015, this is all 2015 now, in a different part of Northeast Brazil, but yeah, there is development of this paralysis, but Guillain-Barré, they can start again, it starts in the toes of your feet, works its way up the legs, can work up to the lungs and paralyze your breathing muscles, your diaphragm muscles. And Guillain-Barré can be caused by lots of infectious diseases, and sometimes we don't have any explanation for it, but viruses and bacteria like Campylobacter. But I don't think at the time anyone thought that it was due to Zika. Although in retrospect, in French Polynesia, they had an earlier outbreak in 2013 and into 14 of Zika. They also had patients with Guillain-Barré, I think around 70, so which Dr. Moyes, Dr. Fauci reported that in the journal of January 13th this year. And then by early September, perhaps the very end of August, so I was very fortunate to be able to meet a doctor, I have a slide, in Recife, Northeast Brazil, Dr. Vanessa Vanderlinden, who's a pediatric neurologist, as is her mother, Anna Vanderlinden. And both of them are in practice still. And they were among the first 3 people who as best I can tell, who recognized the increase in babies born with microcephaly. It's because, as she's told, and she's been quoted a lot in the New York Times and lots of places. And she and her mother are co-authors in the British Medical Journal paper that came out yesterday about the 23 children and their brain scan findings from the CPs. And I met with her. She went through about 20 of the brain scans. And I felt so bad because her clinic has their children lined up for a long way. And she's taking time to show them all these brain scans every word. So she said that there was one child in late August that she wasn't sure if that was due to Zika or one of the many other causes of microcephaly. But by September, she said, whereas normally she might see 5 children a year with microcephaly, now she'd see 5 every couple of days. And she said, she called her mother and said, you won't believe what I'm seeing in the clinic. It's terrible. And I saw 5 children, in the past 5 days. And she says, Vanessa, I saw 7 in the past 5 days. So to me, as a clinical physician, I call that hard data. In other words, there's something wrong going on. There's something new going on. And in other words, there's an epidemic of microcephaly. And it's not just them, obviously. It was being recognized by other doctors as well. I think the first author of the British Medical Journal and quite a few others, they started to notice the increasing number of children born with microcephaly. And you can argue, as many people did and have, and some still continue, I think, but not many, that there's not really an epidemic of microcephaly. It's that before Zika was linked to microcephaly in Brazil, Brazil as a country had underestimated the number of cases each year of microcephaly. And now they're way, way, way overestimating the number. In my opinion, both those things could well be true. And they'd be true if the outbreak was in this country or it was in France or it was in Taiwan or anywhere else. That's part of outbreak investigation. You want to cast a wide net, make sure you don't miss any cases. You're gonna evaluate some children that actually don't have it. But in Brazil, I think they were doing an excellent job. And partly why it's taken so long to evaluate. Now it's been over 7,000 suspected babies with microcephaly. So it's still an ongoing process, but they do the head scans on every baby. And then they started being able to do the blood tests as well for the virus. So it takes a long time. But the WHO report, which is my second to last slide today, that comes out every Thursday, reported that there's over 1,000, I think it's over 1,100 children with Zika leading to microcephaly, being reported from Brazil. And they still have several thousand more to evaluate. Dr. Vanderland told me this I think, great anecdote that while Brazil reported to WHO that they have this outbreak of microcephaly in October, it was on the 26th of October that her and her mother and a small group of epidemiologists and they call them infectiologists, infectious disease physicians, and pediatric neurologists and pediatricians, they started to meet. And it reminded me of San Francisco in 1982. We did the same thing with early AIDS. Like, what does this do to us? Is it bad water, bad air, bad whatever, drugs that people use, whatever. It's a virus, it's HIV. But I hadn't discovered that. So she says, it was someone, not her, she says someone else who in this group suddenly said, it could be Zika. We should test for Zika as the cause of microcephaly. And so very soon they started doing that. But by November the 11th, Brazil reported a national public health emergency due to the microcephaly. So I think that's a very early, very positive, very proactive response on the part of the country. And it was only a few days later, the 17th, that the Zika virus was found in the amniotic fluid of 2 women who were pregnant who ended up having a fetus, newborn with microcephaly. And this was done by Brazilians, not by the Americans or by the French or the British or anybody else. It was their idea, they did it, their laboratories, and they found the virus first. The Pan-American Health Organization also, in my opinion, has done an excellent job, just like Brazil has in terms of the response. On November 17th, they put out an epidemiological alert for all of the Americas for microcephaly. And December 1st, they put out an alert for a link of Zika and microcephaly. They didn't say it was a cause, but said there's an association. It might be an important link. It might be causal. So then, something very, very, very important happened. In my opinion, it was the pivotal event. But I didn't appreciate it at the time, and I think it was underappreciated. I'll say that, underappreciated by most people. since I didn't even know it, I couldn't even underappreciate it. So that's worse than underappreciating, not knowing. Really, this is what I think that I'm like supposed to do with the few years I have left, is like know these things and do something about them. I didn't do it. I didn't know about it. So what happened is November 24th, and some days before that, so probably it was between November 17th when the Brazilians found the virus in the amniotic fluid of 2 women who were pregnant. So in those 7 days, retrospectively, the health officials in French Polynesia looked back to see if, in fact, they had missed a spike in microcephaly and congenital neurological abnormalities in French Polynesia when they had the outbreak of Zika, well, following the outbreak of Zika, which was September of 2013, thank you, to March of 2014. So then if it's a pregnancy, then you should add 9 months or add 6 months, depending on when the infection occurs, what month of pregnancy the woman was in, once you got the Zika virus infection. And so by 2014, when they went back, they saw they had 19 cases of neurological abnormalities, which is what this says in French, which is French Polynesia. This is from the Ministry of Health. In French Polynesia in 2014, I think there was 1 case in 2015, early 2015, after the Zika epidemic from September 2013 to March of 2014. So for me, again, this was the pivotal point, this was the branch point. This was the call to action. And really for me, it was because of what I talked about here 2 Februaries ago, some of you remember it. For me, it was Ebola, which had a very profound effect on many people and still does in people in West Africa. It's affect, I think, more than 1 generation, and not in a good way. But I was very fortunate to be able to work in Sierra Leone with patients and then work in Liberia with MSF with patients. And so I want to say this correctly. That working with patients in Sierra Leone and then in Liberia and then later visiting Guinea and then going back to Liberia in 2015 to visit some Liberian healthcare workers and some of the patients who had survived. I saw the effects or the consequences of decisions that were or were not made in Geneva or in Washington, D.C. or in the capitals or in Beijing with regard to, and other places, with regard to the Ebola epidemic in West Africa. And the United Nations high-level panel that the Secretary General Ban Ki-moon convened April 2nd produced the report. It's posted on the UN website. It's dated January 25th. It was posted February 6th. It's a look back on the Ebola epidemic and how can we prevent this ever happening again. And it has 27 recommendations. But at the very beginning, it says that Ebola was a preventable change. I couldn't agree with that more. So that's probably where I should stop, except to say that with regard to what's next for me, I never once thought that I should write a letter or write an email to the Director General of the World Health Organization or write a paper calling on the Director General to convene the emergency committee immediately to evaluate microcephaly and Zika. Who am I to do that? It's actually my responsibility, is what I felt after Ebola. Why isn't somebody else doing it? That really bothered me because I'm back like making up new words and you're like calling me direction. Like, there's a name for that. It's like, it's a psychiatric name. but at the end, you have to do reality testing, right? So you write what you think is, you try to write a cogent argument or what you think needs to be done and why. And then my view is then to take somebody that I know, that I trust, and so I did to a co-author here, this Journal of the American Medical Association paper that came out on the 27th, Wednesday morning, 10 a.m., online. Professor Larry Gostin from the O'Neill Institute for National Global Health Law person. And he's actually friends with the Director General, or he was. And I think the O'Neill Institute is a WHO collaborating center. Or it was. And we do have someone here, Professor Phelan from the O'Neill Institute, so be careful what I said. But I think we still are WHO collaborating center. But nevertheless, we felt strongly, and actually, Professor Gostin toned down the title. I was enhancing preparedness. I said, who's going to read that? Like, that's not why we're writing this. It's like, we have to say, WHO, well, I went, this is a webinar, never mind. But I thought, put our message in the title, because most people aren't going to read the paper if they don't, it's it's the title that's going to attract the reader or not. But it turns out that there was a press release made by Georgetown, and a lot of interviews were given. I'll just say that. For me, this was what I'm supposed to do. This was the right thing to do. And the main thing I just really want to emphasize here is what we were calling on the Director General of the World Health Organization to do, Dr. Margaret Chan, was not to declare a public health emergency of international concern. That's not. I can't speak for Professor Gasson, but that's not my job or responsibility. What we called on her to do is to convene the emergency committee. It's their job to advise her on whether or not it's a public health emergency of international concern, and whether it is or it isn't, what recommendations to give her as the Director General of the World Health Organization. So it's, and only one person can convene that committee. It's only the Director General. That's the way the international health regulations are written, which personally I disagree with strongly, because there was a very long delay between the recognized beginning of the Ebola outbreak in March 23rd, March 22nd of 2014, and August 8th, when Dr. Chan convened the committee and then declared a public health emergency of international concern due to Ebola. And that had terrible consequences in West Africa. I was able to go over on August 10th to Sierra Leone to start working, and I saw what that meant, that delay. So for me, it was, I regret that I didn't go to Brazil in November or December, and I really regret not reading the website of the French Polynesian Ministry of Health. The data was there. The information was there. That the link to Zika and microcephaly didn't start in Brazil. So on February 1st, Monday, Dr. Chan convened the committee, and they unanimously voted, according to the chairman, Dr. David Heyman, who wrote an article along with 11 co-authors from the committee in The Lancet on February 10th online, February 20th in hard copy. Unanimously said there should be a public health emergency of international concern declared, but not for Zika virus per se, but for the, I'm paraphrasing here, but clusters of microcephaly and other neurologic conditions. And I think they're mostly referring to Guillain-Barré at that point. And I think since February 1st, the WHO headquarters has done a very good job in terms of coordinating the global response to Zika, particularly under the umbrella, if you will, what they call the Strategic Response Framework. And again, as you know, as we mentioned, WHO last Thursday, April 7th, said Zika is a cause of microcephaly and Guillain-Barré syndrome. And yesterday, after 5 p.m., the New England Journal article by 4 CDC authors said that Zika is a cause of microcephaly. They didn't say that it's a cause of Guillain-Barré syndrome. And I suspect that they will, but it doesn't matter what I suspect. It's what they do, or I think they will make a decision one way or the other soon. So just to lead into the final couple slides, and one other major point. 744. So again, I was very fortunate, in part thanks to David, to be able to visit Brazil, to go to the epicenter. It's the first epicenter. There's going to be a lot more epicenters of microcephaly and Zika neurological syndrome, ZNS. Probably it's the epicenter for microcephaly because that's where the virus first appeared for whatever reason in northeast Brazil. And this is a rehabilitation center where Dr. Van der Linden works. This is her assistant. Again, she spent a lot of time in the clinic seeing some of the babies with microcephaly and the parents, and seeing the brain scans on a lot more patients. So again, any former students here know I like the phrase, what's next? What's next? What's next? With regard to any given outbreak, but also there's always going to be more outbreaks, right? There's SARS, there's MERS, there's Ebola, there's bird flu, there's Zika, and they're all zoonotic, right? They're all coming from animals to our species. And there's other ones out there. My operational belief is that the next public health emergency of international concern is already in our world. It's already out there, but we haven't recognized it. Or maybe it hasn't gotten big enough. Maybe yellow fever in Angola come around. Maybe. I hope not. I don't think so, but time will tell. So what's next for me then became, I was in Brazil, and on February 9th, right when I was flying there, the WHO, it's called the Weekly Epidemiological Record, I think, published online rapid publication by a doctor named Heinhauser, and the last author died right. Basically a chronology since 1947 of Zika, including Yap Island, Micronesia in 2007, and then French Polynesia, and then Easter Island in February 2014, and Latin America. And in my view, very, very importantly, Cabo Verde, another Portuguese-speaking country. island nation in West Africa. So say more about that in a minute. So anyway, so what I thought was, now we have the two countries, French Polynesia and Brazil, that have epidemics of microcephaly following epidemics of Zika. So God forbid if Zika causes microcephaly, like back then in February, I said, God forbid if it does, but it means that this epidemic wave of Zika in all of these countries, which was confirmed on these dates according to that chronology that was published February 9th in the WHO website, means that if you add 9 months, plus or minus, and probably if you had 6 months or 7 months or 8 months, the timeline of pregnancy means that there's going to be epidemic waves of microcephaly, which means congenital neurological malformation. So I made this list February 10th and started sharing it, shall we say. Didn't always get a good response, didn't always get any response, but again, I felt like it's my responsibility to say this. I think this is what's going to happen. And a lot of people said, you really lost it. This is too big a nightmare to happen. But I think the virus and the mosquito don't really like our species, and so they don't really care if we think it's too big of a nightmare. So then the paper was published, 2 papers published March 2nd and March 4th. One from the United States, three places, Florida, Emory, and Hopkins, and one from Brazil, where they took neurologic stem cells, progenitor cells in vitro, and they infected them with Zika. But guess what strain of Zika they had available? What they used? They used the African strain, one of the earliest strains from the rhesus monkey in 1947. And what happens is the cells are infected and a lot of them die. Now, actually, David pointed this out to me. They didn't have a negative control group. So, in other words, another flavivirus like Zika, so dengue, for example, to show that it's not just something that flaviviruses can do to stem cells, neurostem cells. But those papers got published, and then just recently, I would say in the past week, there was a paper from, I think it's the same Brazil group, where now they did use dengue as a negative control, but they also used Zika virus from a patient that had been isolated from a patient in Brazil. So it's a so-called Asian strain, but I think it's Asian, and I call it Asian Latin American strain. And it also affected and killed the neurological stem cells. What I'd like to see, and I haven't seen yet, is a side-by-side comparison with the appropriate negative controls. For example, dengue, African strain of Zika, and Asian Latin American strain. But the fact that the African strain in 2 separate labs, or multiple labs anyway, at least 2 separate labs, infected and killed the cells is worrisome to me enough that operationally then I thought that really we should look, the international committee should look a lot closer at Cape Verde, and maybe there's going to be epidemic waves of microcephaly in Cape Verde following their Zika outbreak, which originally said it started in October, same time as Colombia. But it turns out now it's been found that it's started the last week of August. That is in Cape Verde in West Africa. So a lot of people have said, and they might be right, but I disagree. I think because there's never been a report of Zika virus causing microcephaly in Africa anywhere ever, that the African strain can't do it. Doesn't cause microcephaly. To me, I think it depends a lot on, could we have missed that signal? And if it was rubella, which causes microcephaly in a very high percentage of women during first trimester infection, I think maybe we wouldn't have missed it. But Zika, it might be a much lower percentage. From French Polynesia, the paper in Lancet said it's only 1% of women who are infected in the first trimester who have the fetus has microcephaly. But data from Brazil suggests it's probably higher. But in my case, in my opinion, we can hypothesize and guess, but in the end, we need to do prospective studies in Cape Verde and anywhere in Africa, including continental Africa, including the countries that had Ebola. Can you imagine if now they have epidemics of microcephaly and Zika? To me, that means we have to take some action. So what I did was wrote this paper. Not that Professor Gostin didn't want to be on this one. It's like getting even more extreme. No, I just Friday night, instead of having a good time, whatever, I just read it. So I read this paper. And fortunately, it was was able to be reviewed quickly by the editor and someone else, and then quickly on March 17th, a journal called Health Security by Outbreak Baltimore. And this was basically, it was an argument for doing prospective studies in Cape Verde and for microcephaly, because they already had their Zika epidemic. So now plus 9 months, plus 6 months, plus 7 months. So I predicted by June, but May, that there would be children born in Cape Verde with microcephaly. And in addition, the second part of the paper is only 2 pages. That's as much as I can write these days. The second page, it's only half a page actually, it's a page and a half. The second part was to say there should be diagnostic tests available, PCR for example, for Zika in West Africa, including the 3 countries that were affected by Ebola, and Guinea-Bissau, which is just north of Guinea. Guinea-Bissau because it's another Portuguese-speaking country like Cape Verde, like Brazil. And there's travel, so look at where do planes travel? Well, they travel at Northern Mexico, but there's a lot of travel between Cape Verde and Guinea-Bissau. So my guess would be that would be the next country. In my view, my hypothesis is Zika is already in Guinea-Bissau. But how would we know if there's no laboratory capability to diagnose it? That was the paper, March 17th. So to my surprise, really, so the paper was accepted in press, okay, on Sunday the 13th. And on Monday, the 14th of March, the first baby with microcephaly was born in Cape Verde. Tuesday the 15th, the Minister of Health of Cape Verde had a press conference, which you can find online, the transcript. It said that we don't know because we can't test for Zika in Cape Verde, but we're concerned. And it was the mom who delivered the baby wasn't someone that they were following. So again, my argument at the WHO should send epidemiologists and other specialists to help Cape Verde. And so they did, but it's not because of the page and a half paper that I wrote. It's because there was a child born that Monday the 14th. So then by Friday the 18th, Dr. Chan, the WHO Director General, announced that she was sending a team of specialists, laboratorians, epidemiologists, maternal child health specialists to help Cape Verde do more comprehensive studies for microcephaly. And then it turns out that as far as the lab diagnostic tests, I thought, well, WHO can do that also, but I should have known better. No, they don't have their own labs. But US CDC had just gotten on March 16th approval through the FDA emergency use authorization for a new PCR test that recognizes Zika and chikungunya and dengue, or trio bugs. So I sent an email to Director General Chen, didn't answer me. Sent an email to Dr. Tom Frieden, the head of the CDC, on Friday night. Yeah, this pattern, Friday night. Yeah, the 18th, anyway. So, whenever it was. And so, but I heard back an answer the next morning at like 6 a.m. Okay, I'm up, but that's impressive to me. And so basically they said, yes, we'll provide, yes, the US CDC said, we'll provide the trioplex to any national laboratory that formally requests it, whether the countries in Africa or the countries in Latin America or anywhere else. So I was very, very helpful. So the last 2 slides are these. This is today's report from the WHO. Every Thursday they put out a report after the Zika global update. And this is the table 3. It's usually page 8. And now there's 6 nations with Zika associated or Zika linked microcephaly. So this is the way they list it. So rather than have me make a slide, this is the slide. Snipping tool, my favorite friend. It's snip and cut and paste. So here it is. Brazil 1,113. Cape Verde 2. Oh, so the March 14th and last week they reported a second one, WHO did, and it was a baby born on March 24th, who presumably got infected in Cape Verde, but for whatever reason the mom delivered here in the United States. And I haven't heard any more, I haven't seen that in any newspaper announcements by the CDC, but it's verified that it's happened. And then Colombia now has 7 PCR documented virus positive children. They're testing a lot more. Again, I thought that Colombia and Cape Verde would not have an epidemic starting or any cases of microcephaly until May or June. But again, it depends. Maybe the outbreak started earlier, Zika, and if the mom was infected in month 3 or 4 or 5, or perhaps even 6, it's been reported from Brazil. That would explain why there's some cases now earlier than Polynesia 8, Martinique, I'm not sure why 3. To my knowledge, I haven't been there, but that's a small population. Panama, excuse me. I was going to say Panama 1, so last year there was Panama 1, so now Panama 3 as well. And then 2 cases that were the United States was Hawaii, but someone had been in northeast Brazil. And Slovenia, I'm pretty sure also Brazil. So this is what we're seeing. Each week you can see how it's going to change. But again, God forbid, but I think it's going to go like this. More there's going to be epidemic waves of microcephaly and congenital neurological syndromes, Zika, in country after country after country. There might be second waves of Zika infection, for example, in Brazil this year, because it primarily affected the northeast, not so much the southeast like Sao Paulo or Rio or elsewhere. I hope not, but I think we should anticipate that to be the case. And then to close is today's Washington Post by Lena Sun. CDC confirms Zika virus causes microcephaly and other severe abnormalities. This is where we are today. So thank you very much for coming this evening, and I'd love to have any questions or comments that you have. First question. So there's a room full of people that can answer this probably better than me, but my simplistic view is if you don't look, you don't find. And if you do look, you might find it. Hopefully you'll find if it's there, but you have to look hard enough and wide enough and long enough and center. So I was glad to hear from John Epstein from Deep Health Alliance today that the USAID funded PREDICT program that already works in many parts of the world, but not everywhere. They weren't in West Africa, to my knowledge, prior to Ebola. And I don't think they work that much in the Amazon basin or anymore. So whatever. And we went to the Middle East when MERS came in. So, but I'm pretty sure that they're going to be looking hard, or maybe they've already started, in Brazil and elsewhere. And it seems like a natural thing to do because, well, for the obvious reasons. I mean, even if we can do our best to control the virus and control these mosquitoes, if there's a somatic cycle, then it could be with us, with our species for a long time, with all the ramifications of that. And to me, it really emphasizes more the need to develop safe and effective vaccines that can be offered to men and women, because again, as you know, the virus can be transmitted in the semen, as we learned Ebola can be for a long time. With Ebola, we don't really know how long with for men. To my knowledge, 62 days is the longest that the Zika virus has been found in semen in man. But it is a sexually transmitted disease, which we didn't have much data on prior to this. And there's one case in American, in Senegal, Colorado, but now it's definitely a fact. The virus can be transmitted from man to woman, from man to man. It's in the semen. Yes, ma'am.
So kind of on that note, do you know how the healthcare policy or even like social perceptions of things like birth control and like abortion procedures have changed as a response to this outbreak, especially in a country like Brazil?
So now I'm very confident to say that I'm outside my ability to expertise. I probably should stop with that, but I'm not going to just say that. Again, others who know more than me about this, and I should probably just stop. But I'm not aware of any changes that have occurred. I guess that's really what I want to say. I've been there from that and talked to people who know, but again, I see hands that maybe would be interested in sponsoring.
Georgetown last week talked about El Salvador basically told people don't get pregnant
until 2018.
The whole countrywide make that recommendation.
Right. Can I the deadlines from that energy.
So in Brazil, abortion is illegal. Not only illegal, but socially frowned upon. But it's done under the table, and I've heard figures that as many as the majority of pregnancies are unwanted and that occur unwanted, and many of them are secretly aborted, but it never gets reported. I'm hearing from pediatricians in Brazil that abortions are increasing, and use of birth control. Birth control is not illegal, but it's again, in a Catholic country, you have to work hard and pay a lot of money to get the appropriate birth control a lot of times. I think what's happening under the table is women are becoming empowered over this issue, and they're starting to form women's networks. And, it hasn't led into any policy changes yet that I know of, but things are percolating. Women are becoming involved, becoming empowered, and I think there's a movement towards having women have more access to birth control and abortion, even though it's illegal, and even though abortion is illegal and birth control is hard. It's somewhat different in other countries. I think in Colombia, abortion is not illegal, but in basically in all the Catholic countries, these are socially sanctioned things. It's not just something you do when you say, okay, I'm going to have an abortion, and then ask your family. There's a stigma associated with
Rachel?
Kind of related to it, is there any preparations for starting or planning for that? How that would affect or what's right?
So I can say yes, confidently. I don't know so much about the details, but I know that there is a lot of discussion about how can you try to make Rio, because that's what the Olympics are. It's their winter or summer. How can you make them Aedes-free? I think that's a huge goal. But what I've heard discussed is including the armed forces, large numbers, like 200,000. And obviously there's some discussion about ethics saying, well, maybe we don't go. So it's a very high visibility issue, and of course it's a difficult time for Brazil now politically. So there are a lot of issues, but it really will recognize major concern and help to allay the fears and people. So for me, I'm going for sure. I've never had the Olympics, never had tickets, but this is impacting history, so I'm going for sure. I don't mean that in any negative way. I'm just saying, I'm going to do that. And be careful when I come out. Summertime, or back in the certain times. So there are other issues. Wow, there's a lot of questions.
Social messaging, risk communications, but we're also putting together kids who are very neurotypical of the insecticides and the and that sort of thing. So there's just a big conference at CDC. I don't know if that's real, but a lot of that was discussed there. So those are trying to manage whatever the legislative and policy situations are by doing a lot more education. Question for you about this some of these symptoms are very similar to some of the hemorrhagic diseases. So most of the laboratory capacity, like in West Africa right now, we're being able to try to differentiate since we started out cases of Ebola as well.
So tell me you didn't read the paper, because I'm so happy nobody else has seen this.
Well, no, because I was asking the question once. I was so happy to see it tweeted it, but I'm really concerned because we still don't have robust lab capacity there for
not at all. Even for Lassa, it's endemic in Sierra Leone for decades, and for Ebola with new outbreaks in Guinea and Liberia in the past 2 weeks. So I think so. The answer is I would say we have better PCR laboratory capability because of Ebola, but it's not good. And it's not adequate. But also there's the operational difficulty of how do you get the patient samples to the lab? We saw that in Freetown in August of 2014, where it's the capital of the country and there's no PCR lab to diagnose Ebola. So we had to go 5 hours by a vehicle, if the vehicle had petrol, et cetera, up country to Canada, and it took 3 days for results. By then, if the patient had Ebola, then what we did is they had malaria and polyvirus. It was, to me, it's something I'm thinking for. And so I think what we need is point of care rapid diagnostics. That's what we need. So if you're in the forested region of Guinea, you can get the diagnosis. You're not going to get the blood and send it to Congress in any meaningful time.
So we've got a saliva test because there's something working on.
So what I would like about salivary HIV is you don't have to draw blood. There's no needles involved. There's less risk to bottles. And, 900 healthcare workers in West Africa got infected with Ebola. 512 died. How many American healthcare workers died of Ebola? How many have ever died of Ebola? 0. So, Rachel, we might ask. Sorry.
Question on our ability to diagnose causes of miscarriages. So the question is, how do we diagnose causes of miscarriages, understanding that some of these fetuses may not come to fruition? And then also, our big argument right now is on money on the Hill. We know that we're pulling back a bowl of money right now. Can you kind of tell us some stories of what some of that capacity building could be, should be, overseas, and then even domestically, we're seeing some of our capacity money being funneled into Zika.
So you spoke last month, everybody knows you're for Senator Tractor, right?
Yes. My name is Rachel. I work on the Hill. So loaded question.
Exactly.
Yeah.
Yes, sir. Go ahead. Lead the with us. So I don't know anything about Capitol Hill or about money, but I know about Ebola. Any money that has been repurposed, if that's the right word, for Zika from Ebola that had to do with Ebola in West Africa, I'm 100% against it. Viscerally, emotionally, intellectually, cognitively against it. There's still outbreaks going on. In my view, I wouldn't be surprised if there was another outbreak of dozens or hundreds of patients in West Africa with Ebola. In fact, it might be happening. It might be in the southern forest region or something, because there's always been, whatever the right phrase is, but inadequate communication about the need for public health interventions to stop Ebola transmission. That's been proven. That's happened before. It's not surprising that's really happening now. There could be a bigger outbreak than we know about, dozens of cases. So that's me. So it's in our interest to finally stop the Ebola outbreak there before somebody gets on a plane from the capital and flies here again. Beyond the fact that they're human beings, we're human beings, they've suffered so much. And the last thing that I would say is that we made a commitment, verbally and financially. And now we're taking the money back. What does that say about what Americans are going to do next time? Because some other outbreak or similar countries. I'm totally against it. The attack, I understand.
Yeah, and how do we know reasons of miscarriages? How can we diagnose that, and are we seeing miscarriages with Zika?
So my understanding is the answer is yes, there are miscarriages, but how do we know that? You have to find the virus in the mom or the fetus. I don't know if that's, well, I know that's not always happening. There have been reports of a child born with microcephaly, but then there's no testing done, so you can't say that it's microcephaly. Otherwise, I'm asking for help here. How do we know the causes of miscarriages? I think with Zika, you have to go back just for Zika, and otherwise it's whatever other than that.
Because as you said, if there's a spontaneous miscarriage and it's tested, the virus will probably be there, so it can be found. But in places like Brazil, one of the problems is if a woman has a miscarriage, spontaneous miscarriage, she might hide the fact because if you're pregnant, your belly's out, and all of a sudden it's not there, people might think you went and had an abortion. So you don't want anybody to know what's going on. So I think that epidemiologically, it's going to be very hard to figure things out unless the epidemiology is done by women who are trusted, physicians or other epidemiologists who are trusted to work within a network of women and get, truthful information in a confidential way. But I think there's going to be problems. I don't think there's any way that Brazil or any other country with that Catholic, cultural history is going to be able to get perfect data on miscarriages in the middle of the pandemic. They're just going to have to do the best they can.
So to ask you your own question, what happens next? Do you think in 10 years this will still be a problem, or do you think it'll be one of those things where everyone's been exposed or got protected, so for the next 20, 25 years will be safe and then it comes back?
So I've heard experts give both ends of the spectrum, and I'm not actually. But I try to look for an out. So dengue, it's been around for decades, and in more cases than we saw, I understand, last year than the preceding several years. So that's not good. But is dengue the right analogy? I don't know. Has there been recurrent or ongoing cycles of infection with Zika in Micronesia or in Polynesia? It's still in some of the islands, but it's not in Tahiti or French Polynesia, to my knowledge. I know that in Brazil they're very concerned that there's going to be a second wave of Zika, but I think that's partly or largely because it was focused mostly in the Northeast in the first wave. So there's not the herd immunity.
So you think there'll be a second wave pretty in the next couple of years down south?
I think in non-immune populations, yes. If the mosquitoes are still there, we won't come up with some tremendous new intervention. So one question, and I'm just
I think I might actually make this the last question.
oh, sorry. Yeah,
It'll be
short
Dan,
version.
thank you so much. That was a great overview. But the whole group here is here because of One Health. This particular virus has absolutely highlighted One Health internationally better than anything, and the time is perfect for us to continue to enunciate and educate the public of what One Health really means. And part of my question and comment was going to circle back around to the whole idea of funding, because right now, unless we're able to drop these walls of the silos, we don't have enough individual applications for grants. We need to work together, and we need to pull internationally the best of the best. And this one highlights that you need your entomologists, your veterinarians, your physicians, and you absolutely need politicians, because the infrastructure for healthcare in the nations that you just discussed is really, really, really inadequate. And yet, this is devastating to see the numbers that you just highlighted in Brazil alone. So it's a great talk. I just hope all of this can continue to highlight with the One Health paradigm what we really need to have everybody do, which is to bring the best of the best together and work on this, because otherwise it's going to be the delay that you don't want. So thank you so much for tonight's presentation.
Thank you. Thank you for the question. Thanks,
Dan. We really appreciate it. And our tradition, as Dan already knows, but it's give a flag that's been flown over the Capitol building here. It's a thank you and gratitude for presenting to us today. It's great. Thanks. So feel free to hang out, drink glasses, just so you know, go back